I'm a psychiatrist, specialist psychiatrist, and a mental health practitioner in this country. And obviously, COVID will come with a lot of mental health issues: anxiety, depression, insomnia, panic attacks, and things like that. And I really want people to really take care of their mental health. It's very key as you go through this. In fact, we are expecting a pandemic on its own on mental health issues, especially being driven by the fear. And anxiety and depression could be one of those things that could actually increase during this time. And rightly so, I went through that. Suffering from a condition with no treatment and not knowing really what is going to happen, you become anxious. You start to worry about tomorrow and things like that. Like I told you, I said in the other interview, I actually wrote a will during that time and things like that. And because I was scared, and so those feelings are okay, but they need to be managed. And what I've seen is that there are a lot of people who've got so much fear, they are actually creating COVID symptoms, even if they don't have the palpitations, the shortness of breath. That's actually almost like a panic attack that people are having. And I always say that when you see that you have come down and the shortness of breath goes low, it's unlikely to be COVID. Because with COVID, it's sustained and it continues. And one other thing that I want to say is stigma. The reason, one of the reasons why I came out being a deputy director of mental health, one of the things that I really wanted to deal with, and why I came out and said, look, I've got COVID, is to deal with the stigma. A lot of people stigmatize people that then suffer. I've seen people being called COVID center, epicenter, or something like that. I think we need to come out and we need to destigmatize and say, look, this is something that is global. It can come to you, and you don't want people to treat you nasty. Even now that I'm recovered, you don't want people to be standing 10 kilometers away and not even wanting to come, near you, yet you have recovered. So this is a condition where you can recover and become negative. And we need to deal with stigma. And stigma has to do with the people that are suffering. They can actually stigmatize themselves. And also stigma can come from outside, where people stigmatize people that have suffered or have. And I've come up in the open so that we stop the stigma against COVID patients. Even those people that are staying with people that are renting your houses, let's stop stigmatizing those people. Let's celebrate them, those who have survived. Let's encourage them. Let's fight together. Let's stop the stigma on COVID.